This is Dr. Albert Liu, Associate Professor in the College of Health at Lehigh. Thank you for taking the time to get to know the college and me. I received a 5-year bachelor degree of medicine in China. Rather than pursuing a career in medicine, I got a master's degree with a focus on health economics and policy research, and a doctoral degree in health services organization and research. I became a health services researcher because I hope to use my research to inform policymakers and providers and change the healthcare system for better. With training in medicine, economics, and health services research, my research focuses on health services utilization, costs, and quality of care of well-defined patient population. For example, in one project, my clinical colleagues and I studied the health services used by patients with acute low back pain and the overall healthcare cost 1 year after the diagnosis. We found that among patients who used physical therapy to treat their acute low back pain, the earlier they started the physical therapy, the less health services they would use, and the lower the overall healthcare cost would be. In another project, my colleagues and I examined children who received cochlear implants to treat severe or profound hearing loss. Because cochlear implantation is a relatively rare procedure, we put together all procedures performed in Florida over a 13-year period. In this population-based study, we found that Black and Hispanic children were less likely to be implanted before 2 years of age, even if they had a private insurance. We also observed greater racial and insurance disparities in access to implantation before 1 year of age compared to access to implantation before 2 years of age. Another area of research that is important to me is the performance evaluation of healthcare organizations. In the past, my research touched on the performance of acute care hospitals, long-term care hospitals, nursing homes, ambulatory surgery centers, and health insurers. Teaching is something that I really enjoy doing. It's really fulfilling to me when I help my students to build the connections between what they know and what they are about to learn. I always tell my students, everything should make sense. If not, I'm here to help. I teach healthcare management courses such as U.S. healthcare ecosystem and healthcare finance. In U.S. healthcare ecosystem, we go over the roles of all important players in healthcare: healthcare consumers, providers, healthcare organizations, payers, and regulators. In one project, I asked my students to find a health insurance policy that meets one's health needs and costs the least in the real world. In healthcare finance, we studied the key financial management principles, concepts, and techniques as applied to healthcare organizations. That's something about me. I look forward to meeting with you and working with you inside and outside of the classroom. Take care.